Cataract is a common condition that over time can affect your vision. You may notice blurriness, poor night vision, or glare that gradually becomes worse if the cataracts are not removed. Fortunately, cataract surgery can help improve your vision. If your ophthalmologist has told you that you have a cataract, together you are the only ones who can decide if or when you should have surgery to remove the cataract. You will both make this decision based on your own vision needs as well as any other medical considerations. When you talk with your doctor about cataract surgery, take as much time as you wish and ask as many questions as you need to make an informed decision about having the procedure. Just remember, as with any type of surgery, you should have your questions answered before agreeing to have cataract surgery. Now, let's discuss some of the important things you should understand about cataract surgery. Generally, cataract removal is only recommended when you find you're having trouble doing things like driving, reading, or recognizing people at a distance. As your cataract develops, you may find that adjusting your glasses or contact lens prescription may be all that's needed for adequate vision. It's important to remember that your eye's own natural lens, even with a slight cataract, has some distinct advantages over any man-made lens. Cataract surgery means that the cloudy natural lens of your eye is removed during an operation. The most common way of restoring vision after removing a cataract is to permanently implant a small artificial lens in the eye, called an intraocular lens, or IOL. In most cases, the new lens is implanted during the cataract surgery. In rare cases, during surgery, your doctor may discover a condition that could negatively affect the outcome of your surgery. If so, he or she may decide not to insert the lens implant at that time. If this is the case, your doctor will talk to you about it after the surgery. It's important to understand that while cataract surgery and calculations for lens implants are precise, they are not an exact science. To get your best vision after cataract surgery, you usually need to wear eyeglasses or contact lenses for some tasks. In rare cases, an additional procedure may be necessary. As with any surgery, there are risks associated with cataract removal. As a result of either the surgery or local anesthesia injections around the eye, it's uncommon but possible that your vision could be made worse. Complications could occur days, weeks, months, or even years later. These may include bleeding, infection, double vision, droopy eyelid, uncomfortable or painful eye, elevated eye pressure called glaucoma, detachment of the retina, swelling of the retina, clouding of the cornea, retained pieces of cataract in the eye, perforation of the eye, damage to the pupil and loss of vision or even loss of the eye. Some complications may need to be treated by additional surgery. The risk of vision loss or loss of the eye is very low. However, it is important to keep your follow-up appointments with your ophthalmologist after surgery to make sure your eye is healing well. Also, be sure to contact your ophthalmologist if your vision decreases or you have increasing pain or redness. Having an artificial lens implanted in your eye carries its own risks. Complications could develop during surgery, or they could develop weeks, months, or even years later. Problems may include dislocation of the lens, increased night glare or halos, inflammation, or clouding of the cornea. There is also the risk of seeing double or ghost images, or having thinning of the iris, the colored part of the eye. In rare instances, measurements for the power of the lens may result in vision that is significantly different from what was intended. As a result, there may be a need for glasses or surgical exchange of the intraocular lens for the appropriately powered lens. While the vast majority of cataract surgeries have very good outcomes, it is important to remember that no one can guarantee the results of any kind of surgery. You may need additional treatment and/or surgery after having cataract surgery. Although it's impossible for your doctor to inform you of every potential complication that may occur with cataract surgery, he or she will aim to answer all your questions to your satisfaction.